Well, the most unexpected thing we had was that Bill's insurance with his union, once he retired, they never told us there was no out-of-pocket limit. The Provenge treatment that they were giving him was supposed to cost like $90,000, and instead they billed us for $350,000. We then had to talk to the hospital because his insurance would only pay a certain amount, and we were left with an outstandingly huge bill, like $60,000. So we had to go into negotiations with the hospital and find out, what we could do to get that bill paid down. They did reduce it a certain amount. That was not Vanderbilt, by the way. But we had a large out-of-pocket expense with that. So make sure you get it in writing what the exact cost of that treatment is going to be, and make sure you get it in writing that your insurance company is going to cover it. And that's just sort of a practical.
Have you used any of the copay assistance foundations?
We got some help with the Provenge, and we have applied with Zofigo to see if they can give us some help with the cost. I'm on the phone like every morning from 9 o'clock to 11:30 or 12 o'clock trying to find out, what insurance is going to cover and who's going to take care of this and that and why the cost is more. And it's a lot of work just doing the legwork for things like insurance.
At Vanderbilt, we really take special pride in caring for men with prostate cancer. We are very happy to offer resources to patients that we know are up to date and correct, educational materials. We offer financial counseling and financial support. We offer specialty pharmacists that interact with places like Zero, the End of Prostate Cancer, for financial assistance for co-pays. We really try to address not just the cancer treatment, the cancer fighting therapy on its own, but the whole patient. So we also have a nutritionist, for example, and dietitians who help patients who may not be meeting their nutritional needs to make sure that they are at least educated on how they can improve that situation. And I think most importantly and most near and dear to my heart is our multidisciplinary advanced prostate cancer clinic, which we are running right now with a urologist and a medical oncologist, but we will be adding a radiation oncologist to the mix within the next few months. We are also planning to expand that multidisciplinary model to men with localized prostate cancer to make sure that when men are given that initial diagnosis, they understand all of the treatment options available to them, whether that's surgery or radiation, or perhaps even active surveillance if their disease is very low risk.